You have been diagnosed with preeclampsia with severe features. You may be asking, what does this mean? We have created a quick video to help answer some of your questions. Preeclampsia is a condition that occurs in pregnancy and affects the blood vessels that supply the kidney, liver, lungs, your blood cells, and brain. It typically presents after 20 weeks of pregnancy. We do not know for sure why this occurs, but it is thought to be related to the placenta that nourishes your baby during pregnancy. Preeclampsia is diagnosed by blood pressures that are greater than 140/90 and protein in your urine. In addition, you may have more symptoms that classify as a severe feature of preeclampsia. The following are severe features of preeclampsia: elevated blood pressure greater than 160/110. This is why we take your blood pressure at every prenatal visit and during labor. Other symptoms include spots in your vision, sudden onset shortness of breath, a headache that does not improve with Tylenol, pain in your right abdomen where your liver is, and sudden onset increased swelling everywhere, different than the expected swelling during pregnancy. You may be asking, how do you treat preeclampsia? Preeclampsia is actually treated by delivery. Hence, depending on when you are diagnosed, you were likely induced for labor. If you had a severe feature, then you were also given IV magnesium during labor and after delivery. To explain this better, we are going to show you a patient with preeclampsia with severe features next.
Oh no.
Oh, doctor?
Yes. Oh my goodness, your blood pressure is very high. I'm concerned you might have something called preeclampsia.
High blood pressure? I've never had high blood pressure before, and I've never had a headache this bad.
Well, preeclampsia is a disease caused by your placenta, and it can affect your blood vessels. We often see it when you're in your third trimester. Symptoms can include high blood pressure, a headache, changes in your vision, shortness of breath, and even liver inflammation, which can give you pain on your right side.
How do you treat this? This is scary.
Yes, we will give you medications to lower your blood pressure, and keeping your blood pressure at a safe number will prevent a seizure or a stroke. We also give you medication to help with that headache pain, and lastly, we give you something called IV magnesium. Depending on your gestational age, we will also recommend delivering the baby.
IV magnesium? What's that?
Good question. Magnesium is an IV solution that has the mineral magnesium in it. Usually you get magnesium from your diet, but in this case, we give your body extra because we found it can prevent one of the most serious complications of preeclampsia, a seizure.
A seizure? How common are those, and how do I know if I'm going to get one?
Seizures are very rare. However, magnesium is a low-risk medication that can help prevent them. So patients all around the world get magnesium for this problem. We usually give it to you for 12 to 24 hours after your delivery. And during that time, we'll take blood tests and continue monitoring your blood pressures.
This is a lot of information. What do I do after I deliver?
It's really important for you to continue taking your blood pressure at home. If you don't have a cuff at home, please let us know. It's also important for you to take any blood pressure medications that we give you at discharge. And finally, you have to go to your postpartum visit and see the heart doctor when you go home.
Now that you have been diagnosed with preeclampsia, received magnesium, and possibly been started on blood pressure medication, you may ask, what is next? Having preeclampsia when pregnant or postpartum places you at higher risk for high blood pressure, heart disease, heart failure, and stroke later in life. Heart disease is already the #1 cause of death for women in the United States. When you are discharged, we schedule you a follow-up appointment with a cardiologist, aka a heart doctor, to assess your risk of heart disease in the future, to see if you still need to continue your blood pressure medication beyond the 6 weeks, and what you can do to lower your overall risk of heart disease in the future. This is a really important appointment. As a new parent with a new baby to take care of, we know it can be difficult to juggle your postpartum appointments and appointments for your baby. However, the appointment with your cardiologist is important for your future health, and we really hope you attend. If you have any questions about this video, please ask one of your doctors to explain more. Thank you.